Did you know that over 4,000 people right here in Mississippi are living with sickle cell disease? Well, this month is Sickle Cell Awareness Month. And tonight in this segment of Closing the Gap, I want to shed light on this disease, share an incredible success story from two sisters, and highlight how one organization is helping those in need. Meet Erin and Logan Dorsey, sisters and nurses at Children's of Mississippi Hospital. It's the only hospital for kids here in the state. And this hospital holds a special place in their hearts because just a few years ago, they were patients suffering from sickle cell disease, a pain they wouldn't wish on anyone.
The pain itself is undescribable.
To really explain it, it was like glass going through my veins.
For me, it was like sharp stabbing pain.
Sickle cell disease is a genetic blood disorder causing red blood cells to become sickle-shaped and block blood flow, leading to pain and organ damage. According to the CDC, sickle cell disease primarily affects Black or African American individuals in the United States. Just look at the statistics. Approximately 1 in 365 African Americans in the United States has sickle cell disease, and the estimated life expectancy of those with sickle cell is more than 20 years shorter than the average expected. And many people with sickle cell do not receive the recommended health care screenings and treatments.
It's hard. There are times where I felt like I wasn't ever going to have a normal life per se. Having sickle cell, you can't play sports because you can't overexert yourself, or that could cause you to have a pain crisis. You can't go outside too much because being exposed to extreme weather conditions like hot or cold, that can get you sick and cause you to have a pain crisis.
And the two Dorsey sisters admit they spent much of their childhood in the hospital due to their disease.
Yes.
In fact, there was an instance when we were both in the hospital at the exact same time. Sometimes you have to get a lot of pain medicine, blood transfusions, and IV fluids to get well enough to go home and feel better.
And while many children in their position probably would have complained, however, they bonded over their shared pain.
My family was by my side. My sister was pouring into me, encouraging me. The doctors and nurses were pouring into me and encouraging me.
We would go to the doctor together.
Yeah.
Matter of fact, we would hold each other's hands when we got shots. She would hold my hand. They're like, okay, Logan, your turn, and I hold her hand.
Yeah.
So we really were each other's support system.
After years of suffering, a Mississippi miracle, the Dorsey sisters received bone marrow transplants at the University of Mississippi Medical Center. Their brother Brandon donated his marrow to both sisters.
It's crazy to think that an older brother not only did it once, but twice. And he did it so effortlessly, like he wanted to. He pushed me to want to, give life another shot.
Now sickle cell free, the sisters are now helping patients living with the disease they once suffered from.
Looking back at how many times I would be at the doctor's office, how many times I would be getting poked and prodded, I'm not having to deal with that at all right now, which is a blessing.
I was able to go to school, not have to miss any days. No more hospital admissions. I was able to go to college, complete my degree, obtain my nursing license.
And the Dorsey sisters acknowledge not everyone achieves a happy ending, which is why organizations like the Sickle Cell Foundation of Mississippi are so crucial. In fact, the two sisters received a scholarship thanks to this organization.
We saw them when they was little, before they had the transplant, and they grew up into beautiful young ladies.
And Janine Tate is the president of the Sickle Cell Foundation of Mississippi.
We have about 4,000 people living with sickle cell disease.
And she's also living with sickle cell.
I am 53 years old. The doctor told me that I wouldn't make it past 30. So basically me and my family was lost, and we had to find out, what is sickle cell disease. And I thank God that we found this foundation, because I tell people that all the time, that if it wasn't for the Mississippi Sickle Cell Foundation, I don't know where I would be right now, because this Foundation really helped me.
And she points out that people with financial difficulties and those living in rural areas tend to suffer the most from living with this disease due to disparities in funding, health care, research, resources, and more compared to other conditions.
Because people that's living in certain zip codes don't have that access again, so they can't get to the emergency rooms. So some people suffer in pain, and we lose patients because they suffer in pain.
Or they're misdiagnosed.
Or they misdiagnosed as well. They don't know that they have sickle cell disease. Yes, exactly. I lived 10 years not knowing that I had sickle cell disease because I was in a rural area, and because we didn't have the best health care, because we didn't have the doctors that was educated on sickle cell. Again, the doctor just told us that it's something going on with your daughter and it's something to do with her blood, but he had no idea about sickle cell disease. So we need doctors to educate themselves on sickle cell disease, because even in emergency rooms when we go there now, one of the first questions that some of them may ask was, how did you get sickle cell, or how long did you have sickle cell disease? We're born with it. All patients are born with sickle cell disease because their parents have the trait. And that's how the patient can get, sickle cell disease.
And that is why this organization has been working tirelessly over the past 2 decades to close the gap and provide support to those affected by this disease through raising awareness and offering much needed help and resources.
We actually partner with the UMMC hospital, with the nurses there, and now we give out packages when they come into the hospital. We give them a packet of a brochure, we give them a packet of the foundation to let them know what's going on, and we have other little swag items in the bag that we give them as well. But we want them to know that we exist and we are here for you whenever you need us. No matter what you may go through. We even now provide assistance for people that needs housing assistance or people that needs utility assistance, and we can even help now with burial costs. So those are some of the other things that the Mississippi Sickle Cell Foundation do.
But Tate and the Dorsey sisters agree that more help and awareness is needed to fight this disease.
We need people to donate funds, to us so that we can put it back in the sickle cell, community. And not only that, I tell people all the time, if you don't have the money, because some people that don't have the money to give back to organization, then donate blood.
Donating blood is definitely something that's important. You yourself might be a donor for another child. So definitely get tested and see how you yourself can be an advocate for us.
And as this fight continues, the Dorsey sisters say they will continue to reach back and provide supportive care for patients battling sickle cell and let them know that there is hope, and they are an example of it.